families' housing needs. I'm Sherry McDonald with the National Alliance to End Homelessness. I'm joined by my colleague Lisa Stand, also with the Alliance, who will help with today's webinar. Before we start, some logistics. The PowerPoint slides will be posted on our website after the call. As well, can you hold on? Please excuse me. I think we may have some technical problems, and I'm going to double check and make sure this is being broadcast. Okay, I'm going to take it from the top. If you've heard me have a bad beginning, I apologize. Thank you again for joining us today for the webinar, Child Welfare Agencies, Identifying and Addressing Families' Housing Needs. I'm Sherry McDonald with the National Alliance to End Homelessness. I'm joined today with my colleague Lisa Stand, also with the Alliance, who will help with the webinar. Before we start, some logistics. The PowerPoint slides will be posted on your website, on our website after the call, as will a recording of the webinar in case you want to share it with your colleagues. Throughout the call, your lines will be muted. On your right-hand side of your computer screen, you should see a question box that will allow you to type out questions. We will do our best to get through all of them and can help follow up individually after the call with pressing questions that remain. Like other poor families, families involved in the child welfare system face significant challenges finding and sustaining housing they can afford. Housing needs are one of many concerns and challenges that they face as parents struggle to remain with their children or to reunify with children who have been placed into foster care. We believe stable housing is a critical component for improving family well-being. In this webinar, we will examine how child welfare agencies are working to address the housing needs of the families they serve and what opportunities exist to build partnerships with child welfare agencies and housing and homeless service agencies to improve both families and child welfare agencies' outcomes. Tony Lohman, who is the research director at the Institute of Applied Research in St. Louis, will discuss his work that in his job, he evaluates states who have child welfare waivers and are using and testing innovative approaches to assisting child welfare-involved families. Stacy Murphy with Abode Services in Alameda County will also present. Abode Services is a leader in providing rapid rehousing services to families in Alameda County. She will describe how her agency works with child welfare agencies to meet the housing needs of child welfare-involved families. And finally, we'll hear from Mary Cunningham from the Urban Institute in Washington, D.C. She is involved in the evaluation of housing and service models, including the use of family unification program vouchers and the new demonstration of permanent supportive housing for child welfare-involved families. She will provide the broad takeaways from the session. So with that, I'm going to turn it over to our first presenter. Tony?
Hi, this is Tony Lohman. I'm from the Institute of Applied Research in St. Louis. And my colleague, Gary Siegel, and I, and along with a number of other people who have worked and studied at the Institute, have conducted a number of evaluations in child welfare in two different areas. We've really studied both ends of the child welfare system. And so we're now on page 2, and I've tried to list the kinds of studies that we've done there. On the one hand, we've done studies of differential response in Missouri, Minnesota, Ohio, Nevada, and now we're in Maryland looking at their implementation of differential response. Differential response focuses on what I call the 85% of families that are reported with what you might call less severe reports of abuse and neglect. And I've listed those there, things like unsafe homes, homelessness, failure to provide for basic needs of children, lack of proper supervision, etc. Under that approach, the traditional CPS investigations are replaced by a family-friendly called alternative response or differential response family assessment. And child safety is assessed, but also a broader assessment is done of family needs. And each of these programs permitted greater flexibility to workers in the choice of services that they would work on with families. And that happened from the very first visit with the family. So that's a big difference between differential response and traditional child welfare. Not all of the differential response programs had extra dollars for services, but they did, in each case, permit workers to engage in activities that child welfare workers probably were less often engaged in the past, and certainly investigators very seldom provided the kinds of services that differential response family assessment workers provided. And I'll talk about that in just a minute. On the other end of the system, we've done evaluations of Title IV-E waiver studies. Title IV-E refers to the federal money that's available to states to match their payments to foster care providers. And the waiver studies allow those monies to be spent differently. And in 2 states, in Mississippi and Indiana, we looked at flexible funding programs under the Title IV-E, in which monies that had formerly been only able to be spent on foster care were able to be spent on a number of different things to either speed the return of children to their homes or to actually avert a placement of children. And if you look at those studies, and I'll give you a reference to those at the end, you'll see that they were spent very, very widely, much more broadly than funds were spent before the waivers were available in those states. Okay, so if you go to the next slide, please. One of the things that's common to all in all of the studies that we've done of child welfare is that the families that are encountered by CPS as a whole are the poorest families in our society. In many of the studies that we've done, a significant proportion of the families, sometimes as many as 2/3, earn less than $15,000 a year, and and we have shown, I believe, and others have shown this too, that the deprivation and stress of poverty are implicated in the child abuse and neglect that is being reported at a particular time, and in kind of the subsequent reports of child abuse and neglect. Sometimes, in fact, the kinds of things that are being reported are simply, or at least in part, a manifestation of the deprivation the family is experiencing. So, for example, if you have a report of homelessness, it's definitely would be accepted as a report of child neglect by CPS. But is it homelessness because of some kind of intentional behavior on the part of the family, or is it homelessness because the family really, circumstances the family really couldn't control? It tends to be combinations of those kinds of things as we look at the kinds of cases that are reported. But I think what we've shown in our studies is that by addressing the underlying material needs, the future safety of children and their welfare may be enhanced. So that, I think that's an important conclusion for the child neglect type cases, and for many of the child abuse cases that we see. Okay, next slide. Okay. There's a very limited time, and this graph that I'm showing you here is an example of a graph, a chart that we have produced in virtually all the studies that we have done, in which we looked at the variations in approach to services that occur when flexible funding is permitted, and when generally a more flexible approach to families is permitted. And this is from Indiana, the Title IV waiver study in Indiana. The red bars show you the families that were waiver families. The blue bars in the chart show you control families. And control families in this case were comparison families that were not permitted to use the waiver funds in Indiana. This graph represents about, actually, a very, very large number of children. There are about 10,000 waiver children and 10,000 control children in this graph. And so we're looking at variations in the kinds of services that were available. So by freeing up money that could formerly only be spent on foster care and allowing workers to use it for other kinds of needs, you see, and particularly when families are involved in that decision-making process, you see big changes occur. So for example, I've highlighted two there. Household needs. If you look at household needs, that refers to things like rent, utility payments, various kinds of appliances in the house that are needed to be repaired, housing repairs. There's a whole set of things that are included in that. And under this particular program, where flexibility was allowed, that jumped in comparison on the control side from 14% on the control side to 43% on the experimental side or the waiver side. Down under housing, you see there was a jump from 10% to 23%. So the point of this is that under these kinds of programs, monies that formerly were more restricted can be applied to the needs of families that generally would have been ignored or are certainly dealt with less intensity than in the earlier system. So if you look through that, you'll see there's a whole set of things that changes that occurred in other areas like basic needs of families. That refers to things like food and clothing and so on. In getting families into job services, other kinds of financial assistance, child care, there's a whole set of things that you can look at there. That graph is very similar to graphs that we found in difference response studies as well. Okay. So can we go to the next slide, please? I thought rather than going through a lot of graphs like that, it might be better to simply give a few examples. And what we typically do in our studies is present the statistical side in great detail, but we also like to put many case examples in our studies, and I'll give you references on the next slide to that. But I thought I would go through these 5 examples. In Mississippi, in the flexible funding Title IV-E waiver study in Mississippi, one case that particularly struck me was a case of a child that was going to be removed from his grandmother's home. And the problem was the flooring of the porch, and I believe inside the house as well. The family was simply too poor to repair that. And so in this particular instance, rather than taking the child out of the home, the worker decided to use the waiver funds to actually fix the house. It's a very rational kind of approach to this problem, it seems to me, because paying for flooring in a house, comparatively, paying for flooring in a house is much more efficient and much less expensive than paying for foster care for a child for several months. In the second example, in Minnesota, this is a differential response study, so this is kind of at the other end of the spectrum, but the child welfare spectrum. But in this case, the worker went to a mom that was living with, I believe, 2 children in a house trailer, again in very dilapidated condition. The mom couldn't afford to fix it. The worker, but in discussing it with her, the mother said, you know, I'm quite handy. I can fix this myself. I just don't have the money to buy the parts that I need. The worker went back to her supervisor, asked her if she could use the funds that were available from the McKnight Foundation for this particular project to help that mom. She came back, gave her a voucher to the hardware store. The mom went to the hardware store, came back and fixed her trailer. Again, averting more drastic action in that family. In one of the first studies we did in Missouri, the third example there, the worker went out to the family and found the basic problem with the family was that they were going to lose their housing. They were behind in their rent and so on, and they were going to lose it. And so she went to work in that case. Now, Missouri had no extra money available for that program, but they did work hard to set up relationships with agencies outside. And she went to the housing authority there in St. Charles County. She worked with the family to get housing. So this was a case of a worker spending time in a way that probably would not have happened in the traditional system, and utilizing community resources for that family. The fourth example I wanted to give was in Indiana, where a mother had a child who was very hyperactive, and the mom had other children. The child tended to run off. In this particular incident that led to the report, the child was actually found 3 or 4 blocks away on a busy street. So something had to be done in that case. So rather than removing the child from the family, which happened often with these kinds of cases in the past, the worker and supervisor decided that, excuse me, I've got a siren going by here. The worker and supervisor decided that the best thing to do would be to put in a fence around that home. Well, the fences are expensive, but not nearly as expensive as the foster care money that would have had to been spent on that child, I believe. And that was, of course, that was the point that the workers made to us when we discussed this case with them. And finally, in the last case, we evaluated a program in Minnesota called the Parent Support Outreach Program, which was really designed to serve families whose reports were not accepted, they were screened out of child welfare, the so-called third track in differential response programs. In this case, the family was living in a tent in State Park, and because they'd lost their housing, they were reported by the TANF work program worker who was worried about the family and the children. And in that particular case, the workers went to work. Again, they had extra money in Minnesota. They spent money and time getting that family into stable housing. So those are some examples. And if you go to the next slide, please. In that, we have many, many anecdotal accounts like that of similar assistance to families, not only in finding housing, but in paying back rent, paying utilities, home repairs. Most of these would not have happened, as I've said several times, had the workers not had the flexibility to use their time and the funds for the broader needs of families. However, the caveat of all that is that in the U.S., in our system, mainly because of the flow of thousands of cases into the child welfare system and the child protection system, these workers are only able to work with families for a very short time, and so this is short-term assistance, and they do not generally address the longer-term needs of debt and employment and income. So more is needed outside of CPS, obviously, for these families. So for those who would like to read more about this and read further examples, I've listed some things on the last slide here. If you look at in the first of these, and they're all on our website at IAR, and if you click on those links, you'll come to the first one is a study of 40 case studies that we did in Indiana. Many of those, as you read them, you will find housing and housing-related problems. The second one is the actual report, the final report in Indiana. And there's a section in that report in which we present various cases in a more summarized way. And finally, the third one I thought I would list is the one for the Minnesota Parent Support Outreach Program. And again, many case examples in which housing is involved in a program that was really at the other end of the child welfare spectrum. So that's my presentation, and I will be glad to answer any questions if I haven't been clear about things.
Great. Thank you very much, Tony. And we are now going to turn it on over to Stacy.
Hi. So my name is Stacy Murphy, and I am the Director of Strategic Initiatives at Abode Services. It's really great that you had us here to talk about one of our newer programs, our Family Reunification Housing Program. You can just, the next slide is the program basics. Alameda County is one of the counties that Abode Services provides housing and services to, and it was also one of 2 California counties that were granted the Title 4E waiver child welfare dollars. Last summer, with the Alameda County Department of Children's and Family Services, which is part of our county social services agency, was approved to use some of the waiver dollars for to serve specifically those families that were at risk of separation or that were seeking to reunify, that were sort of touching the child welfare system already. And the general idea was to supplement the reunification-focused case management services with a range of housing services that included short to medium-term rental assistance, sort of a rapid rehousing model, and housing search and stabilization services, and a few other types of assistance that might make it easier for those families to locate and remain in the housing that they needed to support reunification. So some of the examples that Tony was using applied for our program as well, things like paying arrears or credit repair, et cetera, et cetera. Next slide, please. Our program is a collaboration at the sort of at the helm of the collaboration, as I mentioned, is the Social Services Agency's Department of Children and Family Services, and they're providing the reunification-oriented case management and support services. My agency, Abode Services, is one of 2 housing providers, the other being Building Futures for Women and Children. And Everyone Home is our sort of 4th partner, and they provide overall coordination and support around data collection, reporting, and just general sort of partner communication, all the other needs that arise with a multi-agency collaboration. Next slide, please. So some of the housing services that we're able to offer with our family reunification program include all those here listed on the slide. The truth is most of the families that we're serving have pretty unsuitable housing for reunification. Many are homeless or very precariously housed, staying somewhere where they can't stay for a long period of time, while others are just living in housing that is probably too small or not appropriate for other reasons for them to reunify. So when they're referred over to us, we immediately assess them with a real focus on their housing needs. From there, our housing service coordinator makes a housing plan, including an estimate of how much rental assistance, what type of rental assistance, what other sort of financial and other needs are presenting, and sort of what the goal is for long-term affordability. From there, we typically launch a housing search. As I said, most are unable to stay in their current housing, although not all. Some are able to stay if we can pay back rent and such. So from there, we sort of launch the housing search and typically have to provide an array of sort of supportive housing services around that search. Our program was originally designed to provide, as I said, sort of a rapid rehousing model with, ideally a 3 to 6 month term of rental assistance, and for families to be eventually paying about half of their rent. And the idea with this would be a relatively short-term intervention to expedite reunification. But we found that the level of need has been somewhat greater than this original vision, and some of the families have needed more months of assistance plus deeper subsidies. And I think Tony alluded to that a little bit as well earlier. In addition to this type of rental assistance, we found that most of the families are needing other types of assistance. Many have pretty significant utility arrears or outstanding debt from prior evictions, both of which are pretty significant barriers to future housing placement. I mean, a lot of landlords, this shows up in a credit report and they won't house them, even if obviously the utilities and or other eviction costs were unrelated to the new unit. So one of the really nice elements of this program has been that it allows for flexibility around those costs. I mean, the county and social services agency, it's been, they've defined the assistance pretty broadly, which is essential because the barriers we've seen have been pretty complex. Sort of along these lines, some of the families we're seeing have been somewhat disconnected from benefits. Some are oddly caught in that loop of not being eligible for TANF or CalWORKs until they're reunified, but also not being able to reunify until they have income sufficient to, provide for some type of housing. So it's sort of a catch-22 there. So we've been able, SSA has been a really good partner on this, and we've been able to sort of work out some of those challenges and try to connect, in addition to connecting people to housing, do a little bit more on the income generation and benefits side of things. And that's a little bit, that's sort of a case management function as well. So, we provide the housing services, but the housing services are a little bit of case management too, which supplements the sort of reunification side of things from SSA. Next slide, please. So we've had some really great successes thus far. It's a new program. Like I said, we started basically last summer. And this has proven to be a really essential resources for the families seeking to reunify. I mean, I think that once SSA staff got a really good sense of what they could offer to clients, they were really enthusiastic. Housing, as not surprisingly, is such a huge barrier to reunification. And, until this waiver program came about, there weren't that many resources that were readily available besides the sort of standard housing resources like Section 8 and affordable housing, which take some time and coordination and such. So that's been really exciting. It's also been a great opportunity for us to foreground housing in the conversation around reunification. It's been a really great opportunity for us to advance that housing first model with services agencies that have historically been really focused on service provision, that don't always talk the language of housing first, even if they totally get how important housing is. They're sort of, we have really interesting and at times challenging conversations with our partners around, should this household be focused on bonding with their children, or should they be focused on increasing income to, better afford housing moving forward? And, the truth is it's, of course, somewhere in between, but it's really good to have those conversations and realize the interconnectedness of reunification with housing stability. And along those lines, this program, as I said, has been a vehicle for serving not just, homeless and at-risk families, but families whose barriers are pretty complicated. And that sort of is a segue into the next slide. As is always the case when you start a brand new program, we have had some challenges as well. I wanted to sort of talk about them and highlight them here, not to complain or focus on the negative at all, but to really share that there are some lessons to be learned, and some things that anyone planning a comparable program can contemplate. One sort of administrative piece for us has been the challenge of the structure of the contract. Our program was designed as sort of a one-year pilot, which was then which has then since been renewed for another year. And it sort of renewed at the tail end of the first year. So we've been working within a very limited time frame, and we can't provide subsidies outside of that time frame. So, as sort of a reference, for those of you who are housing providers in the audience, imagine trying to start and end like an HPRP type program in 1 year. As it's just as the length of time left in the contract year is shortening, we have fewer and fewer options to serve people, and we have to be pretty careful about who we're engaging so as not to sort of set anyone up for failure. And this is particularly relevant because we're finding out that a lot of the families who are being served through the waiver program have more barriers to housing than those we saw in HPRP. I mean, they're still primarily homeless families with a lot of challenges, but a lot of the families that we're seeing have housing isn't always at the forefront of what their prioritization of their needs are. I mean, many are still reeling from the trauma of being separated from their children. Some are struggling with relapse, depression, and other things that make it really hard to prioritize housing, even if that will ultimately make a big difference. So, with other programs, other rapid rehousing programs, we sort of had people lining up at the doors seeking assistance. And for this, our housing services coordinators have had to do a great deal of sort of following up with the referrals, sort of re-engaging, and providing a lot of supportive, almost intensive case management to support the reunification case management. So just something to think about in terms of staffing. Another just challenge that we face is really just being pretty communicating clearly with our partners about what the challenges of what housing services are and sort of the challenges of placing people in housing. Alameda County is in the San Francisco Bay Area. It's a pretty unforgiving rental market, and with our permanent supportive housing programs, we have a lot of, with our long-term sort of subsidy programs, we have a lot of landlords who are still interested in the long-term stable subsidies that we can provide. But rapid rehousing introduces its own challenges. Some landlords don't want to do a shorter-term subsidy, and particularly, as I mentioned earlier, if the contract time length is shortening. So, it's more. There's a sort of a quick fix there in terms of just thinking through contract structure and length of time. But those are just planning. Just some things for other programs to think about. Next slide, please. So the current status of our program, as it is right now, 78 families have been referred, 19 have been placed into permanent housing, 4 actually opted for transitional housing, and something like 35, it looks like 35 or 36 were currently in housing search, whereas 15 to 20 were not reachable. This is sort of an unusual status for us. I wouldn't, I think that the truth is this wouldn't be one of our sort of highest performing programs. But we actually think that a lot of this has to do with the subsidy structure right now. I mean, if we could provide some of the families with longer term subsidies, it might be easier to get them into housing. That right now so many are in housing search because we're trying to find that right housing option. So, but for this contract year, we're sort of in the middle of the window where we can place a lot of people. So we've been placing people pretty quickly, and we expect to house a lot of people in the upcoming weeks and months. Next slide. So I've alluded to some of the lessons learned already, but just to sum them up, for anyone planning a comparable program, it's, a lot of education is needed among partners with landlords and such about what it takes to provide actual housing, particularly, short to medium-term rental assistance, managing expectations with landlords, negotiating lease terms, talking through the challenges of housing search in a very difficult housing market. And we found that it's really helpful to share the housing plans with our SSA providers, just so that we know that the services are coordinated. Another lesson learned is that families really may need longer-term affordable housing. The truth is, for some of our families, it might be a long time before a market rate apartment in Alameda County is truly affordable at their income levels. And finally, flexibility with the subsidy term and the uses of the assistance is really helpful. Like I said, some families need longer-term subsidies, and others need subsidies or support with sort of non-traditional types of assistance. So that's basically a quick synopsis of our program. I think overall it's been a really wonderful resource, and it's still really early. I think in the upcoming years, we're looking forward to placing a lot more families and having a lot more success.
Great. Thank you very much. I think I just lost Mary. Mary?
I'm here.
Yep, we're ready for you.
Okay. My name is Mary Cunningham. I'm a researcher at the Urban Institute, and Sharon asked me to talk a little bit about the big picture and talk about what's happening across the country, child welfare agencies that are working to improve and address the housing needs of families and the types of things that they're doing to do that. And then talk as well about some of the opportunities for homeless and other mainstream agencies to partner with child welfare agencies to better serve these families. So I want to quickly, I know we're going to run out of time, so I'm going to be brief, but I wanted to give a sense of the scope of the challenge that child welfare agencies face, that they have to respond to this enormous need. To sort of give you a sense, in 2010, about 3 million children were reported as suspected victims, and about 662,000 cases are in foster care. The median stay in foster care is about 11 months, and we know from the research that about 25% of kids who reunify return or are re-reported to the system. And that this system is really expensive, about $12 billion a year for the federal government. About $3.6 billion of that is spent on foster care. And child welfare agencies have this, enormous responsibility. All of these kids, and their primary goal is really to make sure that the kids have safety, are safe, and that they have permanency. And I think what is also well documented in the literature is this overlap between child welfare involvement and inadequate housing, showing that not having stable housing, whether it be homelessness or doubled up or in living in overcrowded situations or in condemned housing, can really contribute to problems and can increase reports of neglect and abuse. Next slide. So there is this growing body of evidence that shows that housing can make a difference for families involved in the child welfare system. We know from early evaluations of FUP, the Family Unification Program vouchers, and from Keeping Families Together, the New York City pilot, that housing, these are both examples of FUP being a deep subsidy and Keeping Families Together being supportive housing. But housing in general can help prevent out-of-home placement, can expedite reunification, can prevent reentry into the system, and also, and importantly, in today's grim budget environments, can decrease costs for child welfare agencies. And I'm involved in 2 studies, as Sharon mentioned, an ongoing study of the Family Unification Program vouchers and an evaluation of ACYF supportive housing demonstration for child welfare involved families. And through those 2 studies, we've been sort of gathering lessons learned and observing what child welfare agencies are doing to address the housing needs of their families. And Sharon and I actually wrote a paper, which is on the Alliance's website, that documents some of these observations. So let's talk a little bit about some of them. Next slide. So I wanted to focus on 5 places that child welfare agencies are testing and trying out in terms of trying to help their families with housing and stabilizing their housing. The first is really assessing families for housing need, and some child welfare agencies are doing this either through some existing assessments like the structured decision-making models or NCFAS or AFCAR. So these are required data that they may have to collect. And there's limited housing information in these. And I think more and more child welfare agencies are asking themselves, and I think they need to do a better job at this, how many families who come into the system really have housing problems and housing needs, and how do those housing needs affect their child welfare outcomes. And part of that is thinking about as they're developing their child welfare services case plan, how housing fits into that case plan, and creating housing stability plans within that framework, and really monitoring changes in housing, and asking workers to focus on the housing aspects of the family's lives and improving that housing. And as child welfare agencies have increasingly discovered housing problems as related to the child welfare outcomes, they've done things like create housing stabilization units, or try to develop capacity by partnering with other housing or homeless agencies outside of the child welfare agency. And some examples of how they do that are cited in the paper. So for example, Massachusetts Department of Child and Family Services has a housing stabilization unit, and it's about a 5-person team, and that team provides and acts as a resource and expertise to all the caseworkers across the state, so that when housing is an issue, they can reach out to that team and use their expertise to help them identify housing resources and help families get more stable. So those are the first 3 are things that child welfare agencies are trying out, and number 4 and 5 are more about providing actual housing assistance. And I think Stacy and Anthony both gave you really 2 great examples of how housing agencies, child welfare agencies are increasingly looking to rapid rehousing, or either a short-term or one-time assistance to help with rental, paying for rent, and some transitional services, as well as trying to access permanent housing resources, either through FUP or permanent supportive housing, to provide families who need ongoing assistance those resources. These resources are really in short supply. The FUP program is pretty limited. Permanent supportive housing has to date been in really a boutique pilot demonstration form. And I think that a lot of the funds that were available for rapid rehousing sort of decreased with HPRP. But there's, as Anthony talked about, there's been some more flexibility to use Title IV funds for housing services and meeting basic needs. And there's also some opportunities by partnering with and working with TANF agencies to possibly use some of their monies to provide housing for child welfare families, which, the overlap, many of the families who are receiving child welfare assistance are also receiving TANF. So those are some of the types of things child welfare agencies are doing to reach their goals. And like I said, there's more details and some case examples in the paper if you're interested in reading more about them. Next slide. I think some of the early lessons that we've observed from child welfare agencies trying to address housing needs is that it's really important to target families and prioritize resources based on needs, because not every family who moves to the child welfare agency that has a housing need is going to get a FUP voucher or permanent supportive housing. And so making sure that those resources are used for the families that have the highest needs is really critical. And for families who need less housing assistance, who maybe can stabilize with shorter, maybe one-time assistance or shorter-term rapid rehousing assistance, that they're matched to that resource. That agencies have to provide some money for housing, either through some flexibility with the Title IV waivers, through their own. In Connecticut, for example, the actual legislature has dedicated money to housing in the child welfare budget, and partnering also with other mainstream and homeless agencies to access some of the resources, and because these agencies are often serving the same families, to try to serve those families more efficiently. So next slide, I want to, my computer just went off, so just quickly talk a little bit about, for homeless service providers who may be listening in, to really encourage you to think about how to partner with your child welfare agency, because many of the families that, as we know from the research, many of the families that are moving through the homeless system are the families that are also moving through the child welfare system. And the homeless service agencies could benefit and really push, I think, the child welfare agencies to be thinking more about how housing matters for their families and how stabilizing families in housing can help gain those child welfare outcomes. Because the child welfare agencies are really focused on, like I said, child safety, permanency, looking at preventing out-of-home placement and expediting reunification, and also looking at the costs of those services. So coming to a child welfare agency and talking to them about how housing may alleviate some of the family burden and may also help them achieve outcomes that they want, that they're seeking to achieve, can be the start of those conversations around partnering. Often partnerships between homeless service agencies and child welfare agencies start by looking for multi-system families, either through a data match, taking the child welfare administrative data and HMIS data and looking for families that have overlap and trying to identify families who have high needs, but also homeless service agencies providing or leveraging services that they have at their disposal to help the child welfare agency better serve those families. So some examples of that is that homeless service agencies are really good at trying to find housing and working with landlords and convincing landlords to help their families. And so being the expert at housing, helping with housing search, really understanding the market, knowing where to find landlords that will accept families that often, as Stacey pointed out, have not great histories and have trouble passing those housing screens is really critical, because child welfare agencies really don't have that housing expertise. So being the expert on housing, bringing and leveraging those housing search services or any other resources to the table, and really looking to see where your families overlap with the child welfare agency, and showing them the data that we know so far that shows that by providing housing, they can get to the same outcomes, to the outcomes they want to achieve, and may even see some cost decreases or cost offsets is really important. So it's 10 minutes, and Sharon, I think I'll turn it back over to you so that we can have time for questions.
Okay, great. And I will turn it to my colleague Lisa for some of the most pressing questions we've gotten.
Okay, well, good afternoon, and while we're handling the first couple of questions, feel free to go ahead and type in other questions for us. This first one came up in connection with Tony's segment, but I think maybe something Mary could also address. And the question is, which starts with a comment: over the past several years, there's been a change in what constitutes neglect that CPS will investigate in our state. Inadequate housing or homelessness no longer seems to be a rationale for potentially bringing children into care. We would see that housing assistance under a Title IV waiver program would not be applicable because the children involved in households who are struggling with housing would not be at risk for coming into foster care. So the question is this happening in other states?
I'm sorry. I I had a hard time following that.
Too fast. Just
Yeah.
in one state, there's a change in what constitutes neglect, and so housing issues or homelessness wouldn't necessarily be a rationale for bringing someone to care, and therefore would assistance be deemed not appropriate as an intervention?
Yeah. First of all, I think I haven't seen that in the states that we've worked in. Families coming in, a significant portion of families with housing problems and homelessness or near homelessness in our studies have been reported to the CPS agency. Now, what you have to understand is in these programs, that may not be the central issue that led to the report being accepted. It's something that we found that when workers go out with a more general approach to families, to look generally at what families need, not simply focusing on the allegations of a report of child abuse and neglect, but looking more broadly at the underlying problems, these problems are discovered. And one of the problems, I think, in the past was with investigations, particularly in the differential response studies that we've done with investigations. The investigators were focused primarily on the allegations of a report, which may or may not have included housing-type problems and other income-related problems. Whereas the family assessment workers are trained to look more broadly. And so many of these things are discovered. They may not be the central issue of the report, but they're there as problems underlying other kinds of allegations that come in. But nonetheless, I haven't run onto this yet of saying that a housing issue should not be considered as was that the question? A housing issue would not be considered as an appropriate problem for an exception.
Right. I mean that in some states are moving away from that, or at least in this one state, there's been a change so that it's not constituting neglect. So that was the premise of the question: was that happening in other states?
Yeah. Well, I have some sympathy with that in a way, because as I said when I was talking, that many of the things that get reported and accepted as reports, it's unclear to me that that was an intentional kind of child neglect, but rather that in some cases, at least, in many cases, I would say, the kinds of things that are being reported as child neglect that have to do with basic material needs of families are a function of the poverty of the family and the kinds of problems that arise from that poverty, rather than intentional neglect on the part of the family. But those kinds of things are mixed. So I have sympathy with that, but the problems are there. So the question is, do you deal with them through CPS or do you deal with them in some other way? And the way CPS deals with them must be limited, as I said, and as other people have said here. They are not housing specialists. They're not specialists in many of the areas that they encounter. So the question is the problems exist. How do you deal with them?
Sure.
Well, can I jump in, Lisa, and
Yes.
just ask a question for Tony, and then I'll send it back to you. So, I mean, I guess I'm learning about child welfare more than anything else, but it seems that for many, many years, the only resource that child welfare agencies and child welfare workers had at their disposal was foster care or not. Placement of child or not. And so you're seeing some increase in other kinds of tools, including flexible dollars, either at the differential before the families get formally involved with the child welfare system, or at the back end to preserve and reunify children. Do you think that this is growing? Do you think this is going to be more and more the case in the years to come, or is it still relatively new? And how might we in the homelessness services world kind of build support or help support addressing some of the housing needs using either short-term help when we can, or longer-term triaging the longer-term resources to kind of prevent the needless separation of families?
I think that what we have seen is a part of a general movement in child welfare, not just in the U.S. but worldwide. I would argue, away from a focus on kind of a police-like investigation that focuses solely on allegations of reports, to a more family-centered practice. So starting in the especially in the late 80s, and then moving into the 90s and the 2000s, child welfare agencies began to focus more broadly on the underlying problems because it was obvious to anyone that studied these families that kind of approach was needed. So I think that's a movement which has been going on and is growing. You know, as we go into child welfare, talking to child welfare workers in Maryland right now, the way investigators talk, for example, when we ask them questions about how they approach families and what they look at with families and what they're willing to do with families, is vastly different than when I talked with investigators many years ago, say in the early 90s in Missouri and other states. So there's a change going on there. As to how the problem is that they can't, those workers can't be experts in all these areas, so a great deal of education is needed with them, I think. And the relationship between agencies is also growing. In our studies, at least, we've seen that happening. But I think much more needs to be done in terms of coordination and communication, so that when a worker confronts a family and encounters a family, I mean, with these kinds of problems, that they know where to turn, and they can bring in other people from outside CPS into the picture to actually deal with these problems.
Great. Lisa, we only have a couple more minutes, so if you could help us with the most pressing.
Yep, just quick clarifications, and you can answer this, Sharon. The title of the research paper that you and Mary authored that's on our website.
It's the role of child welfare agencies in improving housing stability for families.
Okay, thanks. And then another clarification, this was for Stacy. There was an acronym on a couple of your slides, and we just wanted to make sure we understood what SSA stands for on your slides.
Oh, sorry, that's the County Social Services Agency. That's their sort of home department for children's and family services.
Okay, well, that's all the questions in my queue.
Okay, and I had just one. Is there anything, Stacy, that you can tell us about the data sharing? How do you, it's confidential, child welfare agencies, how do you deal with the information sharing, release of information?
Sure. Yeah, we've had to, before we established the program, we developed ROIs, release of information forms, so that we could share the agency or share the client data. And so that's been critical, because obviously there's a lot of sort of cross-service planning needed, and our housing services coordinators, spend a lot of time talking to the caseworkers. So that sort of relationship is essential.
Great. Well, I want to thank everyone for joining us today, especially Tony and Mary and Stacy, and of course my colleagues Anna and Lisa, who helped with this webinar and helped me with the big glitch in the beginning. So thank you for sticking with me through that. Again, the PowerPoints from this presentation will be available on our website. We'll also post a link to the paper that Mary reference and the PowerPoint separately, so you don't have to listen to the whole webinar to get to those. So again, thank you all for joining us. We really appreciate it. And if you're doing anything exciting in your community with child welfare and housing, and really working to kind of bridge that gap between the homeless services, the housing resources, and the needs of homeless families, child welfare involved families, we'd love to hear about it. So please do let us know. So thank you all.